All right, we should be live. Welcome to today's VETgirl YouTube live event. Super excited and honored to have here with us Dr. Laura Greene. We're going to be talking about, oh no, feline diabetics. As a critical care specialist, I can tell you these are some of my most challenging yet rewarding cases, those feline diabetics. But before we get to that, thank you so much for being here. I know the clinics are crazy. If you happen to have a day off, even better, you've chosen to spend a half an hour with us. So thank you so much for being here. If this is your first YouTube live event, you know we love it when you type it in to a little comment area on YouTube where you are logging in from. My name is Dr. Garrett Pachtinger. I'm the co-founder of VETgirl. I am logging in from fairly sunny Pennsylvania, just outside of Philadelphia. Dr. Greene, where are you logging in from today?
I am logging in from beautiful Raleigh, North Carolina, which has had a little bit of a break in the weather, and I am loving it.
Oh, yeah, it actually hasn't been bad. It went from like Dr. Greene, you were with us in crazy hot Scottsdale for VETgirl. I
Scottsdale.
mean, you're having a cool week there when it was only 105. We're like, oh God, glad it cooled down for VETgirl you to be there. For those of you who were there, I hope you had a great time. For those of you that weren't, NOLA VETgirl New Orleans coming up in June. So we're about to release that on the website. But yeah, please go ahead, type in. We have, let's see, California. As you all type it in, I'll read a couple. I love it. Boston. So we're now the coasts, East Coast and West Coast. New York, Portugal. Welcome, Jose. Good to see you again. Jose always logs in from Portugal with us. Let's see here. Idaho, British Columbia, Canada. So as I promised Dr. Greene, all over the country, all over the world. Kate from Dubai. See, Dr.
Nice.
Greene? I promised. And our VETgirl members are coming through on my promise. So as you continue to type in where you're logging in from, let's get the party started on today's VETgirl YouTube live event. First of all, not only thank you to Dr. Greene for being here, thank you to Merck Animal Health. They're an amazing educational partner to VETgirl. They've been with us since the beginning. And as you know, we've always promised when we've had the great benefit of an amazing educational partner like Merck Animal Health, we're absolutely thrilled to provide complimentary race-approved CE. So again, thank you to Merck for being here with us today and having Dr. Greene talk about this amazing feline diabetic topic. Now, as I said, this is a live race-approved CE event. So how are you going to get your race CE? Either right on the screen, tinyurl.com/VG, which stands VETgirl, VG, and then today's date, 9/12/23. You could type that into your browser, or using your fancy smartphone, you can put your camera feature up to that QR code. It'll give you that link to come up. Please make sure you fill out this form in the next 57 minutes. So it's 12:03 Eastern time now. By 1 p.m. Eastern, please fill this out. That is the way we know who is here and who is eligible to get your race-approved CE credit. That is the only way. After 1 p.m. Eastern, that form closes down and no more race CE will be provided. So we give you not only the 30 minutes during this session, but 30 minutes after to use that URL, to use that QR code, and please go ahead and fill that out so we get you your race-approved CE. As this is a YouTube live event, if you want to make it your full screen instead of that tiny window, please click on that open box. I gave you a little arrow to show you where it's going to be on your screen so you can make this YouTube live event full screen for best viewing. If you're not already a VETgirl member, I certainly hope you consider joining. At least try it out. Become a trial member where you get complete access to the website. Not CE, you can just view our style, whether you're small animal, large animal, leadership, practice management. We do truly have content for the whole veterinary team. Also included in your membership, all of our certificate programs. It's a great way to become more proficient in a specific area. So whether it's anesthesia and analgesia, ER, ophthalmology, etc. Now we have 11 active and live certificates for you to go ahead and view and take and be part of on our platform. With that said, I know you're not here to listen to me today. This is not my topic. I'm so excited again to have Dr. Laura Greene here with us. Dr. Greene, again, thank you for being here. If you can give our audience a little bit of a background, who you are, what you love to do, and then please take it away. The floor is yours.
Awesome. All right. Thank you guys all so very much for joining. I am so excited about where everybody is and where they're listening from. This is a really amazing opportunity to be able to talk with you all. I am a small animal internal medicine specialist. I did several years in private practice before joining with Merck Animal Health, and a major reason that I made that career change was because one of the things I really love to do is to teach and to get a chance to talk to you all, to try and take some of our more complicated topics in veterinary medicine and find ways to break them down and make them easier to handle, because we have a lot going on in the clinic. I remember vividly how busy those days can get. And the more we can streamline our processes and make them easier, the better we can do. So that's one of the reasons I really love this particular topic about managing feline diabetics. And cats are awesome, right? Cats handle everything in such a uniquely feline way. Diabetes is no exception for them. They don't even make the diagnosis straightforward. If you have a dog you're diagnosing with diabetes, they've got that high blood sugar and the glucose in the urine, and you say, you're a diabetic. But with a cat, is it stress hyperglycemia? Are they just having a bad day? Are they having a series of bad days? Are they getting close to being a diabetic, but they're not quite there yet? And then cats also hold out this really tantalizing possibility of diabetic remission. And in my mind, I equate this a lot of times with trying to give a cat a belly rub. It's like, oh, they look like they want it. We're almost at diabetic remission. We're almost there. And then no diabetic remission for us today. So they make things uniquely challenging. And diabetes can always be challenging, especially when you have an unregulated diabetic. I think of it a lot like trying to solve a Rubik's Cube, which I will freely go ahead and say I have never solved a Rubik's Cube in my life. But part of the reason is because I don't know the method for doing it. I change one thing, kind of like I change the dose of the insulin, or then I change the timing of the insulin, or maybe I change the diabetic diet, or maybe I'm looking for an underlying comorbidity. And if you just change them randomly, kind of picking them out of thin air, it's no easier to solve than a Rubik's Cube. So, the purpose of this presentation today is for us to go on a little bit of a diabetic journey, to have a step by step process that you can follow that won't make your diabetic cases any less complicated, but will streamline the process by which you get to an answer. Because if you approach it with this set of steps, with this order, it tends to eliminate how many times you have to take a guess at what comes next, at what you should try to change or alter about the treatment plan next. And along the way, we're going to talk about a couple of key areas. The biggest one, and also one of my particular passions, is communication, because more so, I think, than many of the conditions we manage that are chronic conditions, management of a diabetic involves intense communication with pet owners. There's a lot for them to understand, a lot for them to appreciate, and a lot for them to be mindful of. And if we can figure out the best ways to communicate that information in a way that it's not overwhelming and that they can retain it, we will streamline our process of getting an unregulated diabetic into that regulated state. Of course, there are other things that can trip us up along the way: comorbidities, all of our different types of treatments, some of the terminology that goes with those treatments. We can't do a full deep dive into diabetic treatment today, but there are a couple things I want to highlight. And then monitoring, because no matter what we choose to do to improve the regulation of our diabetic, we're going to have to monitor if our choice is effective. And happily, there are new technologies now that can really help us do that. So let's go ahead and jump into our first step. And the first step might seem kind of obvious at first glance. You'd say, well, we have to decide just how unregulated are they. So when it comes to cats, sometimes that's going to be a very obvious decision to make. If they are single-handedly filling the litter box daily and they're living by the water bowl, just drinking all the time, and you can almost see the weight falling off of them, well then, sure, check. That is an unregulated diabetic. But other times it's not so cut and dry. So take this fictional example of two cats. We have Sprinkles, a 10-year-old female spayed domestic long hair owned by Mrs. Cupcake, who is a stay at home mom of 5 children under the age of 6. That is a busy household. There's a lot going on there. And then we have Frosting, also a 10-year-old female spayed domestic longhair owned by Mrs. Donut. She is an entrepreneur who works from home and considers Frosting to be her muse for the artwork that she sells online. So she is literally staring at this cat 18 hours a day. Both of these pet owners are very devoted to their cats. They bring them in. Their diagnosis is consistent with diabetes, and you get them started on a diabetic diet and their insulin. And a month later, both owners come in, and this is key. They say, "Ah, my cat is doing amazing. They are eating normally, they're drinking normally, they've actually gained some weight back. I'm just so thrilled. Cat's doing wonderful." And you say, "Oh, that's fabulous. I'm so glad to hear it. Let's go ahead and get an in clinic glucose curve." And it looks like this. So, my first question to you all would be, are these cats regulated? And maybe from looking at this curve, you might say, "Ugh, I'm not so sure." But the key take home point here, maybe one of the most important things I'm going to say in this whole presentation, is that for diabetes, management of clinical signs will trump the numbers almost every single time. The fact that both of these cats are reported to be eating normally, drinking normally, and gaining back the weight tells me that this curve can't be what they're experiencing every single day. And this is where it's so important to remember about the day to day variability for diabetics. That if you take a single cat and do a glucose curve on day one and don't change a thing and do a glucose curve on day two, those curves can be so different that you might almost make different recommendations about whether to increase or decrease their insulin dose. So, what we're really interested in when it comes to diabetic numbers is what they're doing on average. And since most of the time we don't get the opportunity to be able to see that, what we are most interested in are their clinical signs. So what I would tell these owners in that situation is, well, the curve today wasn't optimal. This may not be the sprinkles or frosting favorite place to be. We had a lot of excitement going on in the clinic today. Maybe what we might want to do is consider some at-home glucose monitoring later. In the meantime, the most important thing that I want you to do is continue to monitor those clinical signs. Monitor the weight, monitor the drinking, monitor whether they're eating normally. Now, while that may have been the first question, is are they regulated or not? And we are answering that question saying that they're regulated. The next question is, are they optimally regulated? And that's a bit of a cat of a different color because this becomes more about what the owners want to achieve as well as what they are capable of achieving. And this is why I presented those two fictional cases about one family that might have a lot going on. And if we try to force them to fit into that box of what they have to do to achieve diabetic remission, that might not be a good fit for them. It might be that in trying to achieve that, and if we don't have the conversation about what it would take to achieve that, they might actually have a better chance of becoming unregulated. Versus our other family, Ms. Donut, who perhaps has already even read about this and is all in and is capable of being able to put in what needs to be done to be able to try and achieve that. So, kind of along those lines, I want to share a study with you guys that was actually done with the University of Edinburgh, but it was an online questionnaire. And what this online questionnaire was going to actually be asking pet owners was about what they saw. So, we'll see that on the next slide here. What they saw in terms of treatments that were offered to them by their veterinarian, what kind of support they received from the veterinary clinic, and what kind of things would have improved their cat's quality of life. Now, the study was done in the University of Edinburgh, but because it was an online questionnaire administered to pet owners of feline diabetics, what you actually see is that most of the respondents were from the United States, in addition to the United Kingdom. And they had some interesting results, some interesting answers. So, what you'll see here is that they indicated that for less than 50% of them, the veterinarians discussed how to recognize unstable diabetes, remission, or home blood glucose monitoring. And a quarter of them reported that they had not been shown how to draw up insulin. Now, do I think that that is actually true? That for a quarter of them, their veterinarians didn't show them how to drop insulin? Probably not. But what this tells us is the perception that there is so much information being thrown at pet owners when they have that diagnosis of diabetes that it can be hard to remember what was shared with them and what was not. And so we need to find ways to optimize this communication because ultimately, the pet owner's understanding of what they need to be able to do is what helps us to get these pets regulated and keep them regulated. A couple of other interesting things here. Owners indicated that they do indeed prefer to be able to monitor their pet's diabetic control at home. And when asked what the most valuable source of information about diabetes was, they indicated that websites and online forums that they found on their own were the most useful to learn from. Ouch. That one kind of hurts, right? Because we have worked so hard to learn all of this information to be able to give to pet owners to educate them about diabetes, but they're going to websites and online forums as the most useful source of information. But the truth is that those websites and online forums are there for them 24/7 in a way that veterinarians cannot be. They're there at 2 in the morning when the pet owner wakes up worrying about their cat. And if we dive into the data a little bit more, looking at the exact results, we can see that there are a couple of areas of opportunity for us here. So when we look at printed literature provided by the veterinary clinic, 42% of owners indicated that they did not receive this support or was neither helpful nor unhelpful. And when we look at websites and online forums that were recommended by the veterinary clinic, again, 54% indicated that they did not receive this support or it was neither helpful nor unhelpful. So, this is a big area of opportunity for us. And I would encourage you, if you haven't had a chance, to really look through and see what kind of literature you have in your clinic to provide to pet owners, or what kind of websites or online forums you visited that you trust and you would feel willing to send your pet owners to. Find those, make a list of them, and have them available for pet owners at the initial time of diagnosis or any time that the pet becomes unregulated to help you with this conversation. In addition to that, it's a lot for a veterinarian to be able to have all of these conversations in one sitting. And indeed, pet owners tend to have a better response if they get to hear information from more than one source. So, I wanted to make you aware of this ebook series, which is designed to allow our veterinary nurses to feel comfortable talking with pet owners of diabetic pets as well. There are multiple books in this series, but the first book is all about talking with pet parents about veterinary or about diabetes and how to communicate clearly with them, talking about the importance of monitoring, what they are monitoring for, having additional ways to be able to get this information across to our pet owners. Because ultimately, what we're trying to do here is customize our information to allow pet owners to feel very comfortable. And this is a concept that is increasingly appreciated in human medicine with human diabetics, that there's no one size fits all treatment plan. We have to identify what our goals are, identify what the pet owner is going to be comfortable and capable of achieving, and then configure our treatment plan to that and continue to collaborate with the pet owner long term. And again, I know we've spent a lot of time on this already in this particular presentation, but I can't emphasize enough how if we take the time up front to communicate with pet owners to make sure they understand what's going on, that they have multiple resources to refer back to when we can't be there for them, it really does streamline our process of being able to get these diabetic pets regulated in an efficient fashion. So let's go ahead and move on to what our next step is, because I think this also emphasizes how important this communication is. The very next step, once we've decided that a pet is unregulated, is to rule out user error. And this step is a lot more involved and a lot trickier than I think we sometimes give it credit for. Because, for one thing, this is an important step whether or not it is a brand new owner of a diabetic pet who's never managed diabetes before in their lives, or whether or not it's an owner who has had multiple diabetic pets before and is going on year 3 of managing a diabetic pet. Because circumstances change. And just because we know that a pet owner is super comfortable with handling the insulin and drawing it up and giving it, we don't know if something in their life has changed. Like, for example, if they give the insulin every single Tuesdays and Thursday nights, there's somebody else in the family who's giving the insulin, who's never had to give the insulin before. And it just so happens that every time that person is giving the insulin, they're injecting it into the hair coat. And when we look at the pet owner and we say, well, are you giving the insulin under the skin? They're saying, well, yes, of course I am. I have been for years. And they might not take that question very seriously. But we have to ask all of these questions, asking if anything has changed to make sure that we have uncovered every possibility. Because in the long run, we'll waste a lot of time and resources trying to look for comorbidities or trying to tinker with different dosing schedules if the problem is that on Tuesdays and Thursday nights, the insulin is getting injected into the fur. The catch with this is, how does that feel to the owner when we start to ask these questions? Because it's a lot of questions, right? If you look on the screen right now, these are all really reasonable questions to ask a pet owner. Are you rotating the site where they're giving the insulin? Where is the insulin kept? How is it handled? Is the same person always giving the insulin? Can the person injecting the insulin see that needle going into the skin? And these questions on this slide are just the ones pertaining to the insulin. What about the questions pertaining to the pet? That's a whole separate set of questions. What about the patient is new? Are they eating? What do they eat? Do they get extra food? Any new medications? Clinical signs? It's so many questions. And I tend to find that pet owners have one of two main responses to this. They either say, yeah, 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 I got it. Of course, already I'm on top of this. Or they feel like you're asking all these questions because it implies that you think they're not doing a good job managing their pet's diabetes. So, what I recommend to help with this conversation is actually to say, here's a list, make up a list of all of the questions that you would want to ask in this scenario. Have that typed out, printed out. And when you have a brand new diabetic pet owner, go ahead and give them that list and say, at some point in your pet's life, your pet is going to become unregulated. And I'm going to ask you every single one of these questions. That's not unique to you. It doesn't have to do with your situation. I ask every owner of a diabetic pet all of these questions. And that does two things. One, for those owners who are really on top of it, it tends to give them that list so that they keep an eye on these things and can come to you more proactively when something has changed. And for those who never look at that list again, when you pull that list back out when they have an unregulated patient, they understand that, yep, oh, I've seen that list before. This is that list that I was going to get asked no matter what. Really smooths over that conversation and tends to make people answer the questions more honestly and openly. All right, next step. So, if we've decided there's no user error, we've reached the point where what we're going to talk about is finding a problem and fixing it versus tinkering with our diabetic and treating. And I'll show you what I mean by that. To see this a little bit more visually, find it and fix it has to do with intrinsic problems to the pet. Things like acromegaly or hyperthyroidism or a urinary tract infection. This is going to be a comorbidity that you have to diagnose and treat so that it stops interfering with your ability to get your diabetic pet managed. By contrast, tinker and treat it are for those characteristics that are going to be unique to that patient that just need to be optimized. What is the optimal dose of insulin for this pet? What is the optimal type of insulin for this pet, or the optimal diet, or the optimal scheduling? And unfortunately for tinker and treat it, that's the Rubik's Cube stage. Once you get there, you really just have to try one at a time and monitor what the effect is and see if it has improved or achieved the results that you were looking for. That's why that step is last, because you have to have ruled out the first parts. Are they truly unregulated? Is there any possibility of user error? And is there any underlying comorbidity before you get to the tinker and treat it part? Because if you go straight to tinkering with your dose or your diet or your type of insulin and you miss the fact that they have a urinary tract infection or pancreatitis or something else that we can try to fix, we will lose a lot of time and resources to something that we are likely to lose the battle for. So, if we're thinking about find it and fix it, of course, it helps for us to think about what our common comorbidities are, the ones that we would be most likely to see. So, that would be on our next slide, and even the slide beyond that for our common intrinsic conditions. And I don't think that these are going to come as a big surprise to you. A lot of these are common culprits that will increase the counter-regulatory hormones for insulin. So, increased cortisol, increased catecholamines, increased growth hormone. All of these go along with these conditions, and many of these are conditions that we commonly see in pets of the right age that are likely to develop diabetes as well. Certainly for hyperadrenocorticism and acromegaly, those are the two that the fact or the feature of having those lends themselves to likely having diabetes mellitus at the same time. That said, some of the trickiest cases I feel are when you have an intrinsic problem that requires a treatment, an extrinsic treatment that dysregulates the diabetes. And I'll show you what I mean by that. If we think of all cats that are diabetic having a balance between being regulated or unregulated, if I have a cat that develops inflammatory bowel disease and I need to treat it with prednisolone, that prednisolone is going to dysregulate my diabetes. It's going to make them harder to regulate. And I can't just choose not to treat my inflammatory bowel disease. Or if they have chronic bronchitis, I can't just choose not to treat my bronchitis. I have to do something. But what I can do is try to adjust this or optimize it. For example, with inflammatory bowel disease, treating with budesonide, which has less of an impact on my glycemic index than prednisolone does, or treating feline bronchitis with an inhaled corticosteroid. It probably won't fully tip the balance back into being a truly regulated diabetic, but trying to think of alternative treatments that we can use that have less of an impact are going to help us to get these pets regulated more rapidly than if we just try to push through with some of our other treatments that make that more challenging. All right, so speaking of treatments, when we're thinking about treatments, we know that for this presentation, we don't have enough time to talk about all of the ones that are out there. There's some new and exciting ones that have come up. But what I want to actually focus on briefly here today is the fact that, as we learned earlier in this presentation, pet owners are on the lookout on websites and online forums for those other possible treatments. And a lot of times, what they tend to find when they go looking on websites are human insulins, and they want to know more about those. So the first thing that I always tell pet owners is that with regard to the insulin type that we are using, there are only two that are labeled for veterinary use in cats and dogs, and that is Vetslin and Prozinc. And where possible, we like to use those insulins that are labeled for veterinary use. But to have a greater understanding of those insulins that are the human insulins, it's important to understand some terminology. This is a pretty overwhelming slide, which is why I think it can be pretty confusing for pet owners too. Generally, when we're talking about human insulins that are used to manage diabetes, we are talking about insulin analogs, where the insulin amino acid sequence has been adjusted to achieve a longer lasting characteristic in the body, to have it have a longer duration of acting. So that's true for insulin degludec, insulin detamir, and insulin glargine. Insulin glargine has had some interesting offshoots from it. So we now have Toujeo, which is insulin glargine at a higher concentration, but that's the only difference. They are the exact same type of insulin. It's just a higher concentration, but that higher concentration leads to different duration of action in the body based on how the body absorbs it and releases it from its crystallized form. Highlighted in pink there are two that are important to know because they have achieved what is called biosimilar status. So the FDA calls them a biosimilar because they are so similar in nature to their reference project or product, insulin glargine or Lantus, that they can be interchangeably used. And this means that if you write a prescription for Lantus, a pharmacist can change that to Semglee or to Resvaglar because they have that biosimilar status. Basaglar technically would be considered interchangeable, but it came out before the FDA developed its biosimilar status. And so that's the only reason it does not have that interchangeable. So it's important to know these terminologies because I find that it's not infrequent for these to come up in conversation. But last but not least, in the few remaining moments that I have here, if I don't run over time too much, is monitoring. Because regardless of whatever it is that you choose to alter or change as you've gone through this step, it is key to have a way to monitor whether or not your change is having the desired effect. And technology has really enhanced our ability to do that. Of course, kind of the rock star of that is interstitial continuous glucose monitoring. I think many of us have used this technology now. Important things that I communicate, one is that it is an interstitial continuous glucose monitor. It is not monitoring the blood, which means that one, there's a delay, and that's really important for pet owners to understand that there's a delay between when the blood glucose reaches something and when that is transmitted, if you will, to the interstitium. And hydration is really important. If you have a dehydrated pet, which is not uncommon in our unregulated diabetics, your interstitial glucose monitor is going to have a harder time reading accurately. So it's really important to appreciate whether or not the pet is well hydrated when interpreting these results. The other thing that I think it's important to appreciate about interstitial glucose monitors is that even if you only get 2 to 3 days of data, that at home data is invaluable because, again, what we're really looking for is averages of numbers. Day to day variability of diabetics is huge. And if we can get 3 days, that is so much more information than what we could get from an 8 hour in glucose curve, or I'm sorry, in clinic glucose curve. But if you remember, again, referring all the way back to the top of this presentation, clinical signs are the most important, which is why one of the things we'd really love is to be able to have pet owners be able to monitor when there are changes in weight, changes in water intake, or changes in food intake. Changes in weight are pretty easy. They can buy a baby scale at home to be able to measure, but now we also have some technology that helps us with monitoring for changes in water intake. So the Filaqua Connect is a microchip enabled device. It senses the direct microchip of each cat that's in the household, reads that microchip, and can record how much that individual drinks from this app enabled water bowl. And it will send that data directly to the app, records it on the phone, and you get that data and those changes over time. On any individual day, it's hard to interpret that, but over weeks or months of collecting that data, it's very easy to be able to see if you have a 25% increase in how much one individual in a multi-cat household is drinking. So this is a great way to make it easier for pet owners to be able to monitor for those all important clinical signs as we're trying to determine whether or not a pet is achieving those kind of characteristics of regulation. All right, so just to summarize all of this really quickly, again, those take home points of management, decide if they are numerically or clinically unregulated. If they are clinically unregulated, it is indeed time to move on to the next step. User error first. Don't take that step for granted. It deserves a full and thorough workup and the communication needed to be able to talk about all of the things that maybe could be going on. Look for those underlying intrinsic problems, those comorbidities, and then finally look for your external problems. You can start tinkering with the optimal dose or the optimal timing or the optimal diet. And don't forget to use all of the new technologies that we have available to us to help monitor if what you are doing has effectively achieved your aims. So that is what I have for you here today. I hope I haven't run too far over. My apologies, but it's just such a great topic. I'm happy to take whatever questions we have time for.
Awesome, Dr. Greene. Thank you so much. It's such a great topic because I think one, as we know, sometimes our cats don't get their just due in some of our presentations. People always clamor for more feline medicine, so perfect, and such a great topic because I think it's one that can be complicated until you break it down and think about the appropriate steps to get it done. It's one of those things that conceptually is overwhelming, but when you create a stepwise approach to the situation, it's a lot easier to put those pieces of the puzzle together, not only for us as veterinary professionals, but I think for the client as well. And I totally agree with you. Communication is paramount in this. often as a critical care doctor, I see them on not as much the diagnosis side, although sometimes for that, why is my cat peeing in my house, but the diabetic ketoacidosis cases, and you can see it in their faces, in their eyes. Maybe they had a relative that had diabetes and they were overwhelmed by insulin, and all they can think of at this moment is how overwhelmed they are. You mentioned, I can't remember, I love your pet's names, if it was Frosty or the other one, but the 5 children in the house and then the cat, and it's just, I can imagine the stress level of that parent in the exam room thinking about all the after school activities they have to get their kids to, and then, by the way, I need to give my cat an injection, and how do I give an injection? And sometimes injections are scary, and so I totally agree with you. I think communication is a battle that we should win up front and get to them as soon as possible. But again, awesome information. Couple of housekeeping things. Please go ahead and type any questions you have. I'll get to a few of those in a moment. But please also make sure I put it in the chat a few times, and I'll do it again right now. This is the link. Please make sure in the next 25 minutes, if you've not done it already, by 1 p.m. Eastern, please fill out that form so we can make sure you get CE credit. Please make sure you use the email address associated with your VETgirl account. Usually by 2 or 3 p.m. Eastern, I'll get the list and I'll upload your certificates directly into your VETgirl account. So please make sure to use your email address associated with your VETgirl account. Also, again, thank you so much to Merck Animal Health. As I said this before, they are an amazing educational partner for us at VETgirl. They've been with us since the beginning, and we're so thrilled to have Dr. Greene with us and provide this completely free, complimentary, race-approved, amazing CE session. So thank you to Merck Animal Health. With that said, let's get to a couple of questions. And one of them, I know that there are variations of this, Dr. Greene, and it's not always an easy question to answer, but I think one that's plausible enough to think about. What about the cat at home that I know we're talking about giving insulin injections today, but what are your recommendations for the cat at home where the owners just can't give injections? They're fractious. They hide, like that type of problem. What other alternatives do we have out? What other recommendations do you give for those cats that we just can't get injections into, but the owners are very committed to trying to help treat?
Yes, absolutely. And that's one of the scariest kind of situations that we come across, because what do you do? The first thing, and sometimes a remarkably significant change, is having them on that diabetic diet. And I've actually always been impressed for cats. I don't necessarily see this happen as much as one of the times where things broke in the favor for cats versus dogs, where the diabetic diet can have a shockingly strong impact on their diabetic control. So if you have that super fractious cat, if we can just get them to eat that diabetic diet, sometimes we'll gain a lot of control in that period of time. If we're really lucky, we caught this early enough that that may be enough between that and a nutritional plan that starts to begin working on some weight loss if they're overweight, that we can begin to improve their glycemic control. That said, while that's certainly the first step of what I would do, the next thing after that is really starting to try and work to see what kind of things we can do behaviorally to eventually be able to get to the point where we might be able to even give them, gosh, even if we could get in like every other day insulin, which I know sounds like, oh my gosh, what's that even going to look like? But we're trying to get to averages, right? We're trying to see if, as much as we could possibly do, we can improve what their glycemic control is. And the good news is, with some of the newer insulins that are coming out, even some of the research of some of the newer papers looking at ultra long insulins, we may get to the point, I don't know that we're there yet, but we may get to the point where there are once weekly doses of insulin that we could give, a single weekly injection. And you're not going to be able to get there immediately, right? The first step isn't grab the cat and be able to hold it and give it that injection. Maybe the first step is just a nightly routine of being able to pet that cat in the same time every single day. And then the next point is a nightly routine where petting that cat goes to petting the cat and just scratching at one little spot between the shoulder blades. It's a very, very slow process, but you can sometimes get them to the point where you can optimize it to be able to help them, to be able to medicate them. And that's generally where I try to start, is do with the things we can and then see what we can do to try to optimize that treatment over time.
Awesome. Thank you. Another question. You mentioned a couple of comorbidities or challenges when treating diabetics and helping to keep them regulated, and when something can make them unregulated. In your experience, have you seen dental disease be something that is a common cause of not allowing them to become regulated or regulated as much as you would like?
Yeah, I actually have. And I think that that happens because sometimes our feline patients don't get always the same dental treatment. They don't get to go in for those dentals quite as often because the cats don't want to have to come in for these things, and their mouths can get really bad. So do I see mild dental disease doing that? No, absolutely not. But when I see really severe dental disease, we have to remember how inflammatory that is. And the more inflammatory it is, the more you begin to upregulate those counter-regulatory hormones, and it can make it more difficult to get those diabetics under control. And I've seen cats that have really awful mouths get a thorough dental cleaning and extractions, and what do you know, all of a sudden they need less insulin than they needed before, and it's really remarkable to me when I've seen that.
Awesome. And being respectful of everyone's time at your likely lunch hour, depending on where you are in the world. I'll get to one more question here. And I know you gave the two great examples, similar glucose curves, and maybe slightly different family perceptions about what would be the optimal achievement of regulation for that pet. Maybe that entrepreneur wanted a little bit more regulation because they stare at the cat. This is their, whereas the mom of five, that may be good enough. But if you had to then talk to that entrepreneur that really wanted the optimal regulation, what are you looking at for a nadir of where that glucose is going to be? Obviously, we don't want that huge dip, the Samoji or anything crazy, but if you could have dipped that line down a little bit more, where would you have said to the entrepreneur, listen, we maybe have to work a little hard. We're going to get through this. I know you're a super committed owner. Where are you getting along that what number, milligram per deciliter, are we getting to?
Oh, that's a great question. And some of it is how low can you go kind of thing. But actually what I'm really looking for is more stability. What I really want is the least amount of variability over the course of the day that I can possibly achieve. So I would say deer of around 70 or 80. That's going to be as low as I'm willing to go. But honestly, I'm happier if I get a nadir of around 100, but I also don't get a spike that's much more than 200. And then maybe even if I could bring that down a little bit more. And this is what I mean by how much work it takes to get to that, because that might involve small, tiny feedings throughout the day that you have to be home for. That might involve a different dose of insulin in the beginning of the day than at the end of the day. That might even, in some rare instances, involve little sub doses of regular insulin in a super dedicated owner. This is not what I am doing for every diabetic. But if you have someone who is super committed and says, I want my cat to go into remission more than anything else, you might start adjusting it like that. But the workload for that is intense. I can't even emphasize enough how intense that gets to be, to try to make that perfect curve that's really low, that sustains really low, because that's one of the best ways to get them into diabetic remission. So it's really more about that for me than where that number hits, because if they start their day at 300 and they nadir at 70, I still worry that cat's not going to get into remission.
Well, awesome. Dr. Greene, thank you so much for your time. As I said to you off air, so to speak, before, love your presentations, love the information, a lot of praise and comments and thank yous. People want more time. So we're going to have to get you on the books for an hour and a half, not the 30-minute short talk, because people want more. And so, again,
I would
thank
love
you
it.
to you for being here. Thank you to Merck Animal Health. Please remember, I'll put it in there one more time right now to fill out this form before 1 p.m. Eastern. So you still have another 15 or 16 minutes so I can make sure that you use your VETgirl email. I'll get it uploaded into your VETgirl CE account. And we hope to see you online at our next VETgirl event. Thank you all for what you do. I know clinics are crazy. I appreciate you all being here on your short time off, whether it's a lunch break, a snack break, or just another sip of coffee to keep you going throughout the day. So have a great week. Happy early fall for those of you that are in the hemisphere that does that. And we'll see you online at our next VETgirl event. Have a great day, everyone.
Thank you.